Hello, this is a model of the hab head, and we're going to use it to study the respiratory system, and it will show the upper portion of the respiratory system, and the respiratory system starts with the opening to the outside, uh, and these are the nostrils. And the air will move down to the next part, and this area in here is the nasal passages, or it's also called nasal cavity. And some of the things you can see in the model in here are the nasal canchi, and there are three of them. These are bone structures. Uh, the lower one in here is the inferior, and the middle one here is the middle, and the top one in here is the superior nasal canchi. These are also known as turbinate bones, and they are important structures of the nasal cavity because along with the epithelium lining in this area in here, they will provide the air with warm temperature, moisture, and also the cilia and the mucus secretions of the goblet glands will act like a filter to trap particles in the air. In this area also we can see two of the paranasal sinuses. The one in here is the frontal sinus, which is associated with the frontal bone, and this one in here is the sphenoid sinus, which is associated with the sphenoid bone. The air will move down from the nasal cavity down to the next part of the respiratory system, which is the pharynx. And in this area in here, we can see two of the tonsils. This one in here represents the pharyngeal tonsil, and this one down in here represents the palatine tonsils. Also, it's important in here to notice the structure of the roof of the mouth. So we have the bony structure in here, which represents the hard palate, and this will connect to the soft palate at the posterior end, which is made up of basically muscle tissue and connective tissue. And then at the tip in here, we have the alveoli, which is a structure that's associated with snoring sometimes, because it will close the part of the opening where the air flows down into the pharynx. The next part that comes after the pharynx is the larynx area. And in the larynx area, we have cartilages, and we also have what's known as the false and through vocal cords. Some of the cartilages that you can see in this model is the epiglottis. That's the epiglottis in here. That will close the opening to the larynx. The opening of the larynx is in this area in here, which is called the glottis. The other cartilage that's visible on the model, which is part of the larynx, is this cartilage in here, which is the thyroid cartilage. The vocal cords in here, which the names now they're different. There's two of them. The one on the top is known as the vestibular fold, and the one below it in here is known as the uh, vocal folds, because these are the ones that we basically use to make the sounds. The other thing that's important to notice in here is this part in here behind or posterior to the larynx. That represents the esophagus, which is part of the digestive system. So that is part of the respiratory system that is shown on the half head model.